40 years ago, 1 in 50 children in America had some sort of chronic medical condition, whether on medication, under the care of a doctor, ongoing. We jumped to 2007, it was 1 in 5. So we've gone 1 in 50 to 1 in 5 kids in the space of 40 years. And then the latest, like you mentioned, is 1 in 3, getting to 1 in 2 in terms of any sort of chronic disorder. So it's across the board in this generation, and there has to be common denominators that we can all look at.
Right, and isn't that our job?
Right?
Like,
Yeah.
isn't that my job as a pediatrician,
Yeah.
as a public health agent? Like, okay, why?
Yeah.
Why is it
Yeah,
happening?
yeah.
Don't deny it. Why is it happening? Let's fix it.
Exactly. So you mentioned the word already, and it'd be great to dive into it with you in terms of vaccines. As just looking at the whole picture, what are your thoughts?
Yeah, I think it's important for me to start with my position, and I'm not against vaccines. I think they've done a lot of good over the years, but I think that it's really frustrating the conversation we've had around vaccines, especially in the last decade. There's a lot of censorship. We haven't been allowed to talk about it, and my personal belief is nobody should be forced to do things. I think we should have conversations, just like we do with everything else in medicine, and educate, and then families should be able to make the best decision that's right for them, and that's my personal belief. In my office, we have patients that do the regular schedule. We have some that go on a slow schedule, some that don't do it. Most at least do a slow schedule. But ultimately it's up to them. And I never tell people what to do. I don't tell people what to do in my book. I don't tell people what to do in the office. We just talk about it and come up with the best decision that makes sense for them. And it was so censored for so long that it was something I talked about in the office, but never on shows, never anywhere else. And during the pandemic, I got really frustrated, like a lot of people did, and it really pushed me over the edge to want to write about it. And I was getting just more and more questions about vaccines because it was so censored that I felt like I really needed to do the research and look into what exists and what doesn't exist, so that way I can talk about it in the most, educated way possible, given that it's such a controversial topic. And ultimately, there's just a lot that we don't know, but there's a lot that we do know, and I think it's important to have conversations like this, to have balanced conversations, because we want to protect kids from infectious disease, but we also want to do it in the safest possible way. And I think it's really important that we can have conversations where we talk about safety and don't have an arrogance that I think medicine has, that we have the best possible vaccines ever, we've studied everything and we know everything. I think we can always do better. And with a chronic disease epidemic like we're talking about, when you're giving kids more and more vaccines that affect your immune system, that's literally what they're meant to do. They're supposed to stimulate your immune system to protect you. It's also reasonable to have questions around what sort of negative consequences, if any, they could have, given we have an increasing rate of chronic disease, and we should be able to talk about that, and especially in the setting of the actual research, which mostly doesn't look at anything long-term. Most of the studies are very short-term. They're done before they hit the market. And when we're talking about things like autism or autoimmune conditions or allergies, these things take years to develop. And we don't have a ton of research on that. Even if we say that we do, we really just don't. And I think we need to be able to get more of that.
That's
Absolutely.
great. And the same thing where, every child has their own fingerprint, their own face. Bio-individuality, meaning some children are going to react differently to the vaccines, to different vaccines than others. And again, we come into those sort of detox pathways. How well can the body handle that? How well can each individual child handle that? And knowing that it's not going to be across the board the same.
Yep. Two-pointed. Yeah.
Can I just go on that before you go to the 2 points? Because I think that's such a great point. And to me, that bio-individuality is so key to the future of doing vaccines more safely. I mean, ultimately, right now, it's vaccines are safe and effective. That's what we've heard for years. And nothing is 100% safe. And parents are more skeptical about vaccines than ever. And the way to move forward is to figure out, okay, who are the kids that are susceptible and why? Like, what are the genetics? What are the detox pathways? What are the nutrient deficiencies? What are the reasons why you might have a reaction? And then figure out who those kids are. So those are the kids that maybe you do something a little different, or maybe those are the kids that don't get vaccines, or maybe those kids go slower, whatever it is. That's going to give parents more confidence to actually do vaccines. But you have to at least first admit that they can cause a problem in some kids. And for years, it's this pushback that they never cause an issue, and I don't think that's true. I think they cause more issues than we give them credit for. It's not extreme, but I think there are certainly more issues than we give credence to for those vaccines.
Well, thank you for being, I would just say, not just super educated, well-informed, and doing what you do, but brave to write that book because, you could quite quickly put yourself into some hot water. And I'm sure there's been some pushback. But the two-pointed question I had was, can we all agree, at least at this table, that a child, regardless as to schedule, decided, should not ever receive a vaccine if they are not well?
Yeah, I don't think so. I mean, that doesn't make any sense, right?
Yeah.
Why would you give a kid a vaccine if they're sick? I mean, unless there's like a very specific vaccine you're giving for something, but that's not really realistic on the regular schedule. Your body is dealing with, virus, a bacteria, whatever it is. Doesn't make any sense to give an added immune stimulus or make your body deal with something else. You can come back a couple weeks later and do it. So
Right. So that was the first thing I needed to get out.
Rule number one.
Right.
Yeah.
Second, what can we offer as to additional support? I mean, it's a loaded question. There's a lot to talk about here and to unpack. But what can we offer parents as sort of a checklist to provide their children before whatever vaccine schedule is decided on?
Yeah, and that again, it's another great question that's never really been fully evaluated or hasn't really been evaluated much at all. And it should be. What would make parents more comfortable doing vaccines? If you were to say, all right, here are the couple supplements, here are the things you should do, here's the research that we have that decreases your risk of having a reaction. I've never seen that kind of research. So it's something that should be done. I go back to common sense when I get people to ask me those questions. So how do you detoxify? You pee, poop, and sweat. So what are the things that you can do to support your natural detoxification? That is what makes sense to me. And the first thing you talk about, which you already mentioned, is don't go in when you're sick. That doesn't make any sense. If you are sick, just push it back. That's not anti-vax or anything. That's like standard clear medicine. If you're in the middle of being sick, just don't go to the doctor for that. Go for your sickness and then go back to get your vaccines later if that's what you
Except
choose
the
to
kids
do.
are all often very sick, and so parents are trying to
Trying to
find the
find the
time,
window
and then
in between.
and
Yeah.
that's not so easy. But
Yeah.
it is a significant caveat to pay attention to.
Yeah, I get it.
So I mean, in my clinic, I've always advised, there's the concept of preloading, supplement-wise. So we can actually prepare a child or an infant for the vaccine, give their immune system some extra help beforehand, look at those detox pathways, give the supplements that help that.
Right.
So my sort of easy, ABC is, first of all, vitamin C, great antioxidant, great for the immune system, helps the body detox. DHA, the fatty acids, to help protect the brain. Obviously, the brain is the most sensitive and involved with any of these neurological disorders like autism. So we want to give extra support there. Probiotics, the microbiome can be impacted by vaccines just like antibiotics. So we want to give a little extra protection there. Prebiotics and probiotics to protect that. And then in terms of, actual detox, we can look at B vitamins. You can get that from a multivitamin. If you want to go a step further, you can look at glutathione, something like that. But the idea is, help prepare your child for that. Give them the best opportunity to go through it without any incident.
Yeah, and those are very similar to the list of things that we talk about in the office. Magnesium is another one that I think people consider as well. But yeah, vitamin D, vitamin C, zinc, B vitamins, omegas, probiotics. I mean, all those are quite safe in general with minimal risk and lots of benefits. So again, has it been studied to say, well, if you take this much vitamin C, it's going to decrease your risk of... No, that's never been studied. But it should be. They should be running clinical trials on even just the short-term risks from vaccines like fevers and severe pain and redness. You can certainly do those studies, and I bet you if you did, you'd have some mild improvements in some of those reactions and like a little bit of a moderation of the immune system. And that's a good thing. Parents don't want bad reactions. You don't want your kid to feel bad after you get a vaccine. So anything we can do to minimize that and decrease any sort of long-term risk, I think is good. So I don't know why we wouldn't do that. I don't know why we wouldn't study that. I think that would give parents more confidence.